Good afternoon. 30% of children diagnosed with cancer each year live outside of metropolitan Melbourne. The Paediatric Integrated Cancer Service long-term follow-up program facilitates the transition from acute services to the survivorship phase and provides a risk-stratified follow-up care program to survivors of childhood cancer. Whilst the traditional model of care for the long-term follow-up program has been a face-to-face consultation with the metropolitan tertiary hospitals, the program team envisaged using an existing Royal Children's Hospital telehealth platform to introduce a new model of telemedicine for low-risk regional cohorts to support accessibility of the survivorship service and transition of young adult survivors to their local healthcare providers. Our aim in introducing telehealth to regional patients was to build capacity and confidence in local service providers while reducing the burden on tertiary services, and in doing so, also reducing the burden of travel and financial costs on patients and their families. By October 2016, we had begun work on bringing this idea to fruition. We began by informing the acute service paediatric oncologists of our initiative. Following this, engagement with the local healthcare professionals was undertaken, and as it is a prerequisite that these consultations occur with a doctor at the patient end. An eligibility criteria was established whereby all patients would have their initial survivorship consult within one of the metropolitan cancer services and would be stratified according to low risk of complications in relation to both disease and outcomes of treatment. Beyond this, consultations would occur via telehealth. 32 eligible families were offered telehealth, and a monthly dedicated clinic for telehealth consultations was introduced to streamline bookings. Of the 32 eligible families, 11 immediately elected to use telehealth for their upcoming long-term follow-up review. Not all families were interested in using telehealth, and many were happy to travel. Most paediatricians were well engaged, however some GPs didn't feel it was an appropriate consult for their clinic, whilst others had difficulty with technical issues. We completed all 11 telehealth reviews with a long-term follow-up oncologist, the patient and their family, and the healthcare professional between April to October 2017. Early in 2017, we were fortunate to be part of a government-funded Royal Children's Hospital telehealth project to support capacity building in the use of telehealth hospital-wide. Since the collaboration with the Royal Children's Hospital telehealth project, the program has continued to grow. As you can see, we have mapped the patient journey through to transition, developed eligibility criteria and governance, and engaged administrative staff to coordinate appointments. 120 patients were deemed eligible for telehealth, and 18 of these have now been seen via telehealth, creating strong links to their local services, fulfilling one of our project aims. Importantly, 63% of the users rated that they would be extremely likely to recommend telehealth to other patients. Another aim was to reduce the burden of travel, and these 18 families have thus far saved a collective 6,297 kilometres of travel, as well as 71 hours of driving time. That's equivalent to 3 full days of continuous travel. Moving forward, we currently have another 4 telehealth appointments booked and another 24 planned in 2018. In conclusion, this initiative has increased the relationship and rapport with local healthcare professionals, reduced demand on tertiary centres, and importantly, reduced the burden of travel for families. Thank you.